I'm really honored and pleased to present to you my colleague and friend, Dr. Pedro Bermejo. And I have to tell you that what he has endured in the last 24 hours just to get here, I'm glad that you are here. His plane was delayed out of Miami last night. He slept in the Miami airport, and then they routed him to Chicago this morning to get to Birmingham. So go figure. But here he is. He arrived at 11:30 at the airport. I was there, and we broke a few speed limits getting here, but thankfully is here. Let me introduce him briefly and then turn the podium over to him. Professor Pedro Bermejo is a member of merit of the Cuban Academy of Sciences, full professor of the National School of Public Health in Cuba, and adjunct professor of the School of Public Health and Tropical Medicine of Tulane University in New Orleans. He has a notable contribution to the progress in the development of epidemiology in Cuba and other countries of the Americas. He has been temporary advisor to the WHO and to PAHO, a member of the WHO Expert Committee in Epidemiology, director of WHO Collaborating Center for Health and Housing in Cuba for 10 years. And he has participated as a scientific advisor and professor of epidemiology in Colombia, Venezuela, Mexico, Ecuador, El Salvador, and a number of other countries. He has actively worked in the preparation of human resources as professor of public health and epidemiology at several universities. During more than 40 years of work dedicated to the development of epidemiology and public health, he has promoted extensive work for the development of international technical cooperation with action research projects with different agencies, including UNEP, PAHO, WHO, Manitoba University in Canada, IDRC in Canada, and the Canadian International Development Agency. He's made more than 100 national and international publications and several books, all related to epidemiological studies of epidemics and public health strategies for disease control. So without further ado, I give you my friend and colleague, Dr. Pedro Bermejo. Thank you, Dr. Bermejo.
Okay, thank you. Thank you. Thank you very much for the invitation. It's a proud to me to be here in this university with my friend, Professor Paul Erwin. Because the time because there are some change in the last version of the presentation, but today we will share with you the background of this presentation. I want to summarize many things in few minutes. I put it here background, but it's better to say the context. I am going to speak about the Carlos J. Finlay, you may know, and some facts that happens in Cuba in the 1850 year. I am going to speak about the human resources in Cuba, how we prepare the human resource, the health situation in Cuba, taking into account demographic factors, communicable disease, and NCD, non-communicable disease. And I'm going to say what are the challenges that we have in this situation that we have in Cuba. You know, we are now in a very complicated situation, and I'm going to speak. And of course, I am mentioning some point of collaboration that we will have now and in the future, because let me, this is background. Okay. This is a slide just to show you. It's Carlos J. Finlay. He's a very famous person, but since those years, he was working very hard with Walter Reed to develop the metaxenic theory about the vector disease transmission. And this photo is the Commission of the United States and the Cuban doctor talking about the metaxenic theory of the mosquito Aedes aegypti. And at that time, it was a big problem because the Panama Canal and many people who were there died because on them. Just to say that everything that I'm going to say now is because the founders of the Cuban public health in Cuba, this all famous in Cuba. Finlay is very famous, was a candidate to Nobel Prize and recognized for many universities abroad Cuba. This is meaning that since many years ago, centuries, we have a very good people working on public health. And this I am going not to mention to be hurried. Well, and they wrote this sanity practice manual in 1905. And you see, it's working just for Cubans, 33 sanitary doctors and epidemiologists, was published in 1905, 1,005 pages, and free distribution for all the municipal doctors, meaning is primary health care at that time, and now it's primary health care. The document exists in the Library of Academic Societies in Cuba. Because these points, Cuba established the first Minister of Health and Welfare in Cuba in the year 1909. The first Minister of Public Health responded to the development of public health in the country and the advanced ideas about health matters from the School of Cuban Epidemiology. What happened in those years? The yellow fever was eradicated in Cuba in 1908. Bubonic plague in the years. Even the problem that we have with case in many provinces in the country, and smallpox was eradicated in 1923 due to the vaccination campaigns. Vaccination campaigns preparing for the doctors that I mentioned before. This is one note that I selected. You know what is this? It's mortality, morbidity weekly report. And we had in the 90s, in this century, in the 1991, 91, 92, we have a big outbreak. And we have a big collaboration with the CDC of Atlanta. We were here. Some of them were there. We have a very good collaboration. This meaning that everything that happens in Cuba has interest for the United States, because we are close. We have a big community of Cubans here. There are many interchange. I don't know how many flights daily from Cuba to here, and even for other countries, other cities in the state. And this outbreak, I was in charge to advise the government, and with the different things about the outbreak, we have more than 50,000 cases in all over the country. And because at that time we have a very bad situation with the food, and because the deficit of vitamins produce this, people became blind and have different neuropathic effects. Well, now I'm going to speak about the demographic factor. It's very, very big situation that we have now. The human resources, the situation that we have, and the mortality of the morbidity in Cuba. I am going to be very fast in order to finish on time. This is one article. I like it. This is I don't know if you're familiar, Richard Horton, the editor of Lancet journal, and was invited to be in Cuba in 2013, and he wrote this offline about Cuba, saying that the basis of the public health in Cuba have 4 principles. Health is a fundamental right. Health is social determinant. Health can be only achieved through universal and non-discriminatory policy, and health can be only achieved through the social participation at all levels. The reference is there if you want to read the article. This article have many problems with to Richard because there are some controversial problems, but I don't want to speak because the time is going. Well, this is the situation that we have in Cuba. This is the public health parameter. There are, you know, I am not going to mention because data is here, but I promise you that the last version I brought, I have more information that I am giving to you now. But the basic thing is that public health in the health system in Cuba is basic on primary health care. This is one thing that I am, because if we have an outbreak, we have to use it. With the COVID-19, we have to use it, and they are leader in the community apparently. And in this, at that level, concentrate the medical care, the health situation analysis, because they have to do monthly the health situation analysis. They receive teaching at that place. They receive professor, and they have postgraduate studies because they have master degree, PhD degree, and they performance health surveys, meaning this using and interact. This is the idea about the primary health care. And here is the situation in Cuba until 2022. This is a human resources, and the human resources in this circle is divided mainly in doctors, nurses, and the white part of the graphic is because we have a lot of the technicians. I don't know how you call here licenciatura. It's not a doctor, but it's a person that works in the labs, in the repairing the medical equipment and so on. But as you see here, since this is a physician per 1,000 people, and you see how was the situation in the 1960 year. This is just 0.9 doctor per 1,000, and you see how increased the number, and it reflects in the World Health the density per 10,000 inhabitants published by WHO. And if you see Cuba, of course, the same that the US about the number, but it's not allocation, it's number. Because there are differences. You see the Africa countries, they have numbers, but they have not in all the places that are needed. You see the line is the situation is worse in those countries that have the blue intense. Okay, and this is what happened in the last in this century. From 1,000, the number of doctors are increased, and the number of inhabitants per doctors are decreasing. That is normal way, but this is a situation. You have the number. Sorry, there are some slide because it's not the real presentation. I just have an interchange with Professor Irving, and I said just the slide, and some in English and some like we are seeing this one. Well, let's see, this is very important. the demographic and health situation, well, there is a reference between Cuba and the US, but I am not going to mention because you can read it later. But I am going to explain to you now the problem that we have in the Cuba since the last 10 years. This is the fertility under 20 years age, and you see what happened in the east part of the country. This red is a very young people with 13, 14, 15, with 1, 2, 3 children, and they have not enough resources. They have some problems, and it became a problem in Cuba nowadays. And the government are preparing a response to work with that, because it's not going to solve it like this. They have to do many things and improve this situation. And here you have the other side of the problem is the percentage of older adults in Cuba. You see the red line. The line is higher and higher and higher. If you have higher number of old people, more than 65 years, plus less, more young people with the high fertility rate, it becomes a social problem, but this problem is reflected on public health. And what happened now, I am going back to this, that fertility in Cuba, let's say 20 years before, if you put the map like this, the color were almost the same. But now there are differences in the province, as you can see here, and as you can see here in this one. This is the percentage of all the population. See what happened, concentrated in Havana, Pinar del Rio. The red province are in the Cuba context, they have less resource, like Havana as a capital of the country, and some province in the center of the. Let's go to see now the situation of communicable disease. I have not to talk much about, but you see the incidence of meningococcal disease in selected year, solved by the Cuban vaccine. That is one point that we have. The situation of tetanus, solved by the bivalent Cuban vaccine. Here, the incidence of hepatitis, and you see here in that year it was started the Cuban vaccine against hepatitis, and the incidence of yellow fever related with the quality of water. And this is the incidence of tuberculosis in selected year. But the interest of this graphic is, if you see here, as I mentioned before, since 1993, we had the economic crisis in Cuba, where many things happened at that time. As you see, the peak here in those years, and then the line going down. But now we have to be aware that you see the relation between 2020 and 2022 is going up. We have to apply the surveillance and to decide it and to work with what happened with the incidence of tuberculosis in Cuba. One good thing that is in jeopardy now is that Cuba was the first country to eliminate the mother-to-child HIV transmission in July of 2015. And you say this is a WHO director, Dr. Margaret Thatcher. This is the same major victory you can read here. And this is one thing that, if you remember the problem that we have with the fecundity in the young people, this a new version because it's not just HIV, it's the transmission of another, for instance, HIV by contact with mother and child, and many things, and gonorrhea, blenrahia, syphilis, and we are now preparing a surveillance program to work with. And this is the mortality rate for selected infectious disease. If you see the disease, most of them are due to the Cuban vaccines that we work in the biotech center in Cuba. This is the line, and we're very confident that we can keep it because the resources are our resource. Well, and this is the general mortality, crude and adjusted rate in Cuba. And again, see what happened with the colors in the Iceland. Yeah, now we have a different situation, as I mentioned before, but it's a situation that before Cuba was very, very homogeneous, like a country. And here you have the main cause of death and the premature mortality according to the selected causes. And you see the main problems are the cancer, malignant cancer, cardiovascular disease, and this is a three more important, but as a premature mortality, the situation is the same. You see, diabetes is a problem. Of course, cancer is a big problem, and cancer and cardiovascular disease are very related with the premature mortality according to the selected causes. And this is the year of life potentially lost by the, according to the cause of death in 2022. I am not going to explain in details, but you see that if you compare male and female, it's not the same. If you compare maybe the first cause of death, it's not the same cause of year of life potentially lost, and you have the data here. And this infant mortality rate, again, see the map, it's not the same. And in 1 year to 2015, we have in Cuba, the infant mortality rate was about 5 per 1,000, and now the situation, because the situation is complicated, and you see, but again, if you compare this, we have no time to make an exercise. If you compare this, and the other side is the fertility is very high, and meaning that you need to prepare a comprehensive program, not just for public health, a comprehensive program with the government to work with that. And this is one article, is available in the published in the International Journal of Epidemiology. It was published in 2006. That you can read it. Is saying that Cuba have because the health system, because the social programs, we have the situation is an example, and of course include the control of infectious disease, that is very important for us. But now, as I mentioned at the beginning, we have a lot of change, a lot of challenges because the situation, the economic situation is, you may know, by the social media, by different bad and good ideas, but we have many challenges now. And we did an exercise 3 weeks ago. And the first that we decided, well, we'll see what happened in the Latin America countries, what are the challenges, and we'll see what happened in Cuba, because we're very, very, good relation, very good interchange, and so on. And the main challenges are related with demography and urbanization. We have it. Global environmental change, we have it. Technology, that we don't have it because the economic situation don't allow us to that data availability, and study design research models. This is the main challenges in the Latin America and the Caribbean. And this is one article that invited me to write with another professor, Professor Castel. Professor is the director of the public health in Cuba, talking about with the situation that we have. It was published in 2016, but at that time we with this article, they said, be careful because we have to expand health in all policies. And this is the main challenge that we have in Cuba. After we identify what happened in Latin America, what happened in Cuba during the period, we identified these challenges in Cuba related with the structures, with the training in epidemiology and public health, with the national health system efficiency, with the primary health care level, with the secondary health care level, and demographic and climate change. All this, if you want to know, because when we identify this is one big exercise, the Minister of Public Health was in charge and the head of this group. And when we identified this challenge, we decided, well, it was in 2018, because at that time we see that something is going to happen and we have to be careful. And some persons said, well, you are saying reforms, you are saying transformation, but at the end, this article, all these things, if you want to read it, are published in the Pan American Journal. The name of the article is Transformation of the Health System in Cuba. Related with the challenge, there is the challenge that we identify, a group of professors and epidemiologists working in the field and many things, the problems, the difficulties, what we have, and the action that have to be taken. Was in 2018, and after that, the COVID-19 in 2020 appears in Cuba. And those are the new challenges that we have now with the preparation and confronting pandemics, because in Cuba was not a big problem, but the same that happened in the world. The epidemiological surveillance, we have to maintain the health equity is a big challenge that we have now. The epidemiological approach of NCDs, the strength of control of NCD risk factors, and improve research in epidemiology and health system and services. This is a new challenge. Well, now, because I spoke with many times in Cuba and here, and when we have time to talk about public health and epidemiology, in the 2014, we received in Cuba a mission from the AAS. You know what is the American Academy of Science of Americas. And this man published in Science, because Science is the journal that they supported. And this man wrote that even with the situation, the tense and the problems that we have in the situation in Cuba, science and diplomatic have to work to solve the problem in both sides. One example is that, I don't know if you know Professor Milton Terry. He died. He was a very famous epidemiologist in the US and in the world. And he, in the pandemic, sorry, in the epidemic of polyneuritis, he was with us in that. And this is a paper that is a handwriting. I have it. This in my, and I try to explain that we need to collaborate. In this 5 pages, they wrote what happened in Cuba, what you have to do, of course, as an advisor, and we have to adapt these ideas, but it was in 1995. Well, with COVID-19, this is some graphic. Is what happened in Havana province in the capital of the country, and how we work with the Cuban vaccine, because we have not the possibilities to buy vaccines. Sorry, to receive vaccine, even for WHO. If you want to enter in the different choice, you have to pay a lot of money before, and we decided to use our vaccines. Its graphic is very clear. The first is the health intervention with the Abdala vaccine, and then when we finish the intervention, we administrate around 1 million doses in very short time, and the cure decrease. And then we decided to boost the population. And Professor Erwin and myself, we work in this paper published in the APCA journal, comparing the response of Cuba and the United States. Is not until the 2021 that we publish. Well, and this is a big delegation. You may know very famous people in public health in the US that went to Cuba to evaluate the response of the Cuba to the COVID-19 and the situation with Cuba vaccines. They visited many places, and is another kind of collaboration that we have. On the other hand, it's not here, but in the next presentation is that we have a good collaboration and very big collaboration with the Center of Immunology, Molecular Immunology in Cuba, and the Robert Park in here, working with the vaccine for the lung cancer. And in the other presentation that you are going to receive, you will see the outcomes published in Frontiers, a very high level journal. Finally, I think that if we will able to collaborate in science, we have to find many different places, environments, because with the situation of the COVID-19 is an example that no one in the world is protected. No one is have to allocate it to avoid the diseases, and this collaboration is needed. There are many examples that, because in the presentation, there are many examples that we will see, and we are going to see what happened when we collaborated in serious moment, amend the embargo, many things that happen, but we have the scientific have to collaborate it, and we have to prepare. This is one example that we're here discussing the situation in Cuba, what happened in the US. And finally, if you compare that we started the collaboration in 1850, and now, since many centuries, we're collaborating because many things that everybody knows here. I am very sorry because I like the last presentation, but it's impossible to solve the problem with flies and connection because. But anyway, the presentation you will receive today. And if you have any questions, any opinions, any ideas, we are ready to discuss with the ideas, and we can connect it through email, through WhatsApp, through social media, because I think that we need it. We need it to collaborate. We need to improve the collaboration. We have to organize the collaboration because it's a big collaboration. In my experience, is nothing. You have to organize points, possible outcomes, and resources. Three things. If we, not you, if we are able to solve it and to identify this problem, we can do many things for the public health in the world, not just in Cuba and US. Well, that's all, and thank you very much for the attention.